Hi, welcome. We're so glad you joined us today. In this series, we talk about the interdisciplinary recommendations for the psychosocial support of NICU parents. These recommendations were first published at the end of 2015 in the Journal of Perinatology. And this supplement, this special supplement that was published, is open access. And within it, you will be able to find all the different recommendations that we're going to be talking about in these series. We cover 6 domains that the authors and contributors consider fundamental to providing comprehensive psychosocial support for NICU parents. Today, we're going to focus on peer-to-peer support for NICU parents. During this webinar, our objectives are to start to understand the rationale for peer-to-peer support. What is the evidence? Why is it important? How do we help NICU staff and peer mentors support these recommendations, and what resources are available to them as they do it? I'm your host, Erica Goyer, and I'm joined by my co-host, Crystal Grogren from PPA. Our presenters today are Dr. Sue Hall and Christy Love. Dr. Hall is a neonatologist from Southern California. Her experience with psychosocial support began with her career as a social worker, and that work as a social worker has informed how she has practiced as a neonatologist. Throughout her association with NPA, she has spent time advocating for the psychosocial support of families, and she was the lead in developing the interdisciplinary recommendations for the psychosocial support of NICU parents, along with her co-facilitator, Michael Heinen. If you're interested in accessing some of the resources that she developed as a follow-up to these recommendations to help implement them within NICUs, you will definitely be interested in visiting mynicunetwork.com, where they have a course that is available for NICU professionals in order to help implement the standards and guidelines that we talk about in this series. Our other presenter, Christy Love, is a passionate parent advocate. Christy's the mother of 2 preemies, a daughter who was born at 35 weeks and a son who was born at 30. She's been actively involved in supporting NICU families at Mercy Children's Hospital in St. Louis since 2001 and has been a paid position there as a NICU family advocate since 2012. Christy has been involved with the National Perinatal Association for many years and was also there for the founding of the Preemie Parent Alliance and continues to serve in roles with both of those organizations. So as we begin our discussion today, I think we have to start with the question, just what exactly is peer-to-peer support? Dr. Hall, will you start by giving a synopsis of how you talk about peer-to-peer support?
Sure. Peer-to-peer support is when a NICU graduate parent, who's several years out from their experience, becomes what we call a buddy or a mentor for a current NICU parent. Sometimes parents are the only ones who can really understand what another parent is going through. So the parents who act as mentors help the new or current parents navigate the care of their baby while the baby's in the hospital, helps them understand what the procedures are all about, how the NICU works. And in addition, the peer mentors help the new parents just become empowered to be advocates for their babies. The parent mentors validate the parents' experiences because a lot of parents will just think, I'm kind of crazy, I've got all these emotions and feelings and they can't possibly be right. What can I do to get back on steady footing again? And the peer mentor can sit and listen to them and say, yes, that happened to me. And this is how I got through it. And these are some coping strategies that may help you. So it was important to include peer support for several reasons as one of the recommendations. The first is that the American Academy of Pediatrics actually has recommended peer support for all parents of pediatric patients. They don't specifically mention the NICU, but obviously the NICU is a place where this is very important. partly because the length of stay of some of our NICU families can be months. And so having a buddy get you through that lengthy hospitalization is very helpful. We wanted to include it in the recommendations because not that many hospitals actually have peer support programs. There are some like Christy's program that have been functioning for a number of years, but there are many, many hospitals that don't incorporate this type of support, and we feel it's very, very important to NICU parents to have it.
Yeah, I think it's very interesting, the point you brought up about how when we talk about pediatric patients and we talk about, the American Academy of Pediatrics, recommendations, it hasn't necessarily trickled into the NICU space. And yet it's so important because, one of the things we talk about is when a baby is born early or sick, it's almost as if the parent is born prematurely too. And it's not the experience that we anticipated. So Christy, that kind of brings us to something that you said. What is fundamentally different about becoming a parent in the NICU versus what you anticipated parenthood might be like?
Well, I often share that from the moment families walk through the NICU, they're facing trauma in their lives. It's not what they've read about. It's not what they've been preparing for themselves for. And so we need to help these families through their journey. We need to offer them emotional support, strength, and let them know that they are not alone. No two journeys are ever the same. Everyone's journey is very different.
So I guess the next question would be, we know that there are many, many ways of offering peer-to-peer support, and we'll talk about some of the different organizations that deliver these different models. But Christy, with you in your unit where you've been involved for so long, what does peer-to-peer support look like?
So we offer bedside visits when moms are on our antepartum floor. They're high risk, they can't be home, they need to be on bed rest in the hospital until delivery. And then once families deliver, I see them in the unit at the bedside of their babies also, as well as I hold different events. I hold lunches, I hold dinners, just offering an opportunity for them to get out of the unit, to interact with other family members inside the unit. I often, it's a crazy day. It goes by so fast, no matter if I'm there for 3 hours or if I'm there for 12. Half the time I forget to eat lunch. I never check a family off my list once that they have been seen. Doesn't matter if they were there for 3 days or 9 months. I always continue to follow up with them on an everyday basis to see how things are going. As we know, things change every day in the NICU. Sometimes every hour, things can change. One family can be doing quite well one day, and then a day or two later when I'm back in the unit, things can kind of take a turn for the worse.
Yeah, exactly.
So I was just going to add, I'm very fortunate. Recently, we have brought in a child life specialist in our NICU. So I now have a colleague that I can, first thing every morning, we kind of do our own personal rounds and update on what has taken place in the NICU since the last time I was there.
So what does that process look like of kind of checking in at the beginning of your day, and where do things go from there?
Well, the most important thing is to see what has changed from the last time I was there. So I come in, I pull census, I get an update by the charge nurses if anything drastic has changed. We have a tendency to get multiples and clusters. So I might have left and came back 12 hours later, and we had 3 sets of multiples, 2 sets of twins, and a set of triplets. So I just get a consensus for what is going on in the unit, and then follow up on any social issues, if that's with my colleague, if that's with the social workers, and just seeing what is going on with families, because I like to be prepared before I walk in, meeting families where they're at for their situation.
Yeah, I'm sure they appreciate that. That's much easier than having somebody walk into the room that you have to tell the whole story to again.
Well, and also, some families have had losses that I haven't met yet, so I want to be prepared if there was a loss in the delivery, and then the surviving twin is in our unit. Makes things a little easier to navigate.
Yeah. Well, that touches upon something you said when you talked about checking in with parents. Tell us more about your philosophy about that and about the importance of building a relationship and not just showing up.
Yes, so it's very important to me that I never want a family feel like I'm just walking to the room to check them off of my list. I will go in, I will do the initial meet with them, tell them my role, share a little bit about how I got into this position, and just let them know that I have been in their shoes. Um, and then continue to follow up with them every day that I'm in the unit. I follow up with them the next day and the next day through their visit. And as I stated before, it doesn't matter if a baby is just down for sugars and might only be there for 3 days
Right.
or 9 months.
Yeah. Well, and
Wanting them to know that we're with them through their whole journey.
right. Well, it also brings up, I have another question for you real quick, which is, as you go in and you introduce yourself and you talk about why you're there and what your role is, do you think that the families react differently to you than they might to another NICU staff member?
Yes. So I my little buy-in, I think what I get a lot of times is the biggest struggle, right, is getting off is respiratory and feeding. And
Mm.
my son struggled with both. So I have that going for me when I'm talking with a family and they're a little sad because they're, wanting to get off that respiratory support so they can continue on the feeds. And so I use that as an opportunity to share my story and let them know, like, this is going to be a long journey, but look at the outcome. And for me, when I was in the NICU, having a parent that I know had been in my shoes and seen the light at the end of the tunnel, that's all I kept looking for. And so to give families that, like, I know you're here right now, but not every story is a successful story. There are bumps along the way, but there is, at the end, you're going to get out of the NICU, I promise. And, and here's my story. And this is how, don't let this define them, because there's so much more going on.
Right, right. I think that's an important point too, is, the realization that no matter what the outcome is, it can still be a good outcome in some way or another.
Correct.
So,
and I even go as far as, so if a family wants to continue that conversation, I will later on even just share pictures, because they will often, ask where my son is today, and I will share that.
Yeah. So your unit has had a long, well-established parent support program that I think even predated you being there, wasn't it?
Yes, it was founded in 1991 by a neonatologist and a NICU nurse.
So, and it continues to be just a very robust program. And I know how busy you are, and I know all the things you do. And then behind you, you have a whole team of parents and volunteers and supportive staff who are helping you do the work. What do you think? Like, say a new staff member is coming to your NICU and they haven't been around a parent support program before. Do you think they quickly buy in based on the other staff's reaction?
So I do meet with the new fellowship for our staff that when they come in, as well as our neonatologists. If we ever have a new neonatologist coming in, I meet with them as well and just talk about the importance of the support for our families in the NICU. And it's actually very well received.
Right. Because they've been taught all about the medical care, but they don't necessarily have exposure to the rest of this. So Sue, as we look to, again, what professionals need to know about peer-to-peer support, I hope everybody that's, attending this webinar will go back and read the recommendations and look at them. But if you had to pull just a few points
Well, the first is that there's actually a lot of evidence behind peer support being a useful and helpful intervention. There are a number of studies, really actually from around the world. They are in general small studies, but they do show that parents who receive peer support in the NICU specifically have decreased anxiety, increased confidence, and it actually increases the amount of time that they spend with their baby in the hospital, which of course is what we want. We want parent engagement and parent bonding. Secondly, I would like for providers to know that peer support can be incorporated into a hospital program and confidentiality maintained. I think when graduate parents go to hospital administration or NICU administration and request starting a peer support program, they often get pushback based on HIPAA, the confidentiality guidelines. But as long as a parent support organization has clearly defined guidelines for communication and sharing information, what can't be shared and so on, these programs absolutely 100% work. So I think that providers just need to learn how they can make it work rather than just flat out say that it's not going to work.
So yeah, I suppose it's understandable why NICU staff would be ambivalent about this and inviting people into the unit who aren't like them to talk to families and interact with them. So what do you say to, we're asking them to change their behavior. We're asking them in some ways to give up a role that they may have played in the past with some of this psychosocial support. So what sort of things do you say to them, or can you say to them, to help them appreciate what peer support could bring?
Well, I think the main thing is that peer support is different from what professional support looks like. Families are wanting to preserve a certain image with the professionals caring for their baby. They don't really want to come across as not together. They don't want to come across as demanding. They don't want to come across as angry, but they have all these feelings and emotions that they need to kind of unload, if you will. And so the peer support people are a safe place for them to do that. The peer support mentors are not going to take the place of what the professionals can offer, because nobody can offer what the professionals can, but peer support is just a little bit different. So they don't need to feel that their role is threatened at all. It's taking a little bit of the load off them, and it's actually going to make the families easier for them to work with.
Well, exactly. That's the thing. When you talk about this idea, when you're a parent in the NICU, you very much feel like your role as a parent has been changed, and maybe in some ways even taken away from you, and that it now sometimes feels like it's the NICU staff are the ones who really are caring for your infant in a way that you imagined that you would. And there's so many complicated emotions around that are going to come out. And yet they can cause all sorts of discord, especially within a unit with staff or with other families. But I think you're absolutely right. And Christy, after I finish this, I want you to talk about this too, about being able to kind of talk through these things and process these things with somebody who is non-judgmental, maybe somebody who's you don't feel is standing in the way of you and your baby being discharged together, and also wanting to just be seen as a competent parent. How do you do that while you're still experiencing all this trauma? So Christy, what are your insights?
So again, it goes back to, meeting the families where they're at and how they're coping with the situation that they're in. I will use an example for myself. I had a ton of support in the NICU. I think NICUs take great care of families, but we do not set them up to succeed when they go home. So I had great support, but I went home and I crashed and burned. You're in survival mode, and you're just doing the day-to-day things as what was done in the NICU. So getting families prepared and to going home and letting them take care of their baby, let them play that role as they are the parent, and they know their baby, and getting them to bond with them is a great way to help them succeed when they go home.
Yeah, so Christy, I know that you already came into a unit where there was established peer-to-peer support, but then your role within the unit changed. But even with a unit like yours, where they've been so receptive to the role of, NICU veteran parents, what are some of the barriers that you've experienced? And then to generalize it, what do you think are the barriers that are generally put in place, and how can parents advocate or staff advocate for better peer-to-peer support programs?
Well, I think Dr. Hall said it early on when they use HIPAA as a barrier, and what information they're willing to allow you to have access to. So my biggest barrier, even though the position was already there, but I wasn't a nurse, was having access to Epic. And so I started with meeting with the social workers and showing our administrators to know that having this information is going to help me service these families better when I face-to-face with them and at their bedside. And just continuing to do what you're doing, and that is going to improve because they're going to see the success. So it sometimes is very small steps, growing a program and having. When we first started my support group, we only could do dinner, we didn't even do dinner. They would be group discussions. Then to be able to get in the unit to do bedside visits, it was an open unit, so staff could always keep their eye on you. Well, then we went to a private room unit, and here it was me who wants access and wants to communicate with the nurses, and I just continue to ask questions. What's the situation before I'm going into a room? I'm going to meet with this family. Is there anything I need to be aware of? And you just be patient, but also you have to remember and use what Dr. Hall shared, what the research shows, and continue to share that with your administrators and barriers with your different staff members, that this is going to help this baby succeed and get out of here quicker, because the mom and dad isn't going to have the anxiety. They're going to feel the support. They're going to have the encouragement that they are the parent and they can participate.
I think that's so insightful. And I think, the idea that you said, that you show up every day and you do what you're supposed to do and you behave in a way that they can see what you're doing, that's got to be heartening to so many other parents who are starting to do support and maybe haven't gotten past being allowed to host a pizza night or bring in gifts on NICU staff appreciation days, or those little things that generally, NICU support groups do. But to be able to demonstrate how there's so much more that it can be, and it can be so much more meaningful when it's done in the natural environment, instead of asking parents to leave the unit to come spend time with you. So right. What are the things, I know that you have, again, advocated and used a lot of the tools that have been provided by these recommendations and the supporting website and materials and everything, but when you've had to make the case, what have you said, and what would you tell other advocates to talk about when they're making their case? What changes people's minds?
I really focus on mental health. As I shared, I had all the support when I was in the NICU, but going home, I kind of crashed and didn't realize different things that I was going on in the NICU because I was in that survival mode. So I really do focus on mental health, and I have the conversation regularly with our parents to prepare them with what they're going through. It's okay. This is normal if you're feeling this way, but also with staff and our administrators. we focus on mental health with so many other things with our veterans because they face trauma at war and when they were in Afghanistan and different things. We, again, our parents are facing trauma in their life, and this is going on with their family. So we need to keep revisiting this, that we can help this transition. We can ease their pain and their anxiety by having services available to them.
Yeah. And that goes to, I mean, what you said goes to a couple of very important points. One is the anticipatory guidance, but Sue, it makes me think about another area that I know that you've written about and spoken about before. Would you mind taking a moment just to kind of talk about trauma-informed care and what that brings to the NICU?
Sure. So trauma-informed care is a paradigm of care that recognizes two things. One is that people come into an experience possibly having already experienced trauma in their lifetime that will influence how they react to the current trauma. So let's say, you have a parent who's homeless and substance abuser. They've had a lot of trauma, and so they're going to be a little more challenging to work with because of that trauma. So seeing what each individual family's makeup is and what their past experiences can greatly inform how you provide individualized care. The second principle of trauma-informed care is that we in healthcare, as well as other types of social services such as foster care, adoption, and so on, we want to make a potentially traumatic experience as least traumatic as possible so that we don't reignite old trauma or create new trauma that parents are going to have trouble recovering from. There's a number of papers written about acute stress disorder and post-traumatic stress disorder in NICU parents. And we know that the incidence of postpartum depression is about at least three times higher in NICU parents than parents of full-term children. So as Christy was saying, the focus on parental mental health is huge. And so our goal through providing trauma-informed care is to minimize the number of people who leave the NICU with postpartum depression or post-traumatic stress disorder.
Yeah, it's interesting because, like you said, even though the medical setting or this environment, what you're going through might be re-traumatizing and potentially traumatic. I mean, it essentially fundamentally is in a lot of ways. It's also an opportunity when you get the right support to be able to find ways to learn about the trauma and to maybe mitigate some of those negative effects, even from things that happened before the NICU. And yeah. I think about something you've talked about. Can you explain for a moment about staph and vicarious trauma?
Yeah. Just introduce one other concept before I move on to that, which is the concept of resilience. Traumatic situations are moderated or influenced by the supportive networks that we have around us. So we may have families that don't have any supportive networks. Again, the homeless parent or whatever. I mean, not all situations are that dramatic, but a family whose baby was transferred from a small town a couple hours away from the NICU, they may not have social supports that can help them while they're in the NICU. So the peer support program is going to help them dig deep and find their own resilience. And both the staff and the peer support volunteers are going to help support these families. So the other question you asked, remind me again. Oh, staph secondary trauma.
Yeah, the vicarious or secondary.
Yeah. So vicarious trauma is when we witness trauma happening to our patients or families, and we sort of absorb that through going through the experience with them. An example might be a neonatologist and neonatal nurse a nurse practitioner attending a delivery in which a baby cannot be resuscitated. That's obviously traumatic for everyone involved. Certainly the most traumatic for the parents who've lost their baby, but we staff have feelings too, and the work we engage in is pretty high stakes.
Right.
And we can be traumatized also. So it's really in another section of the recommendations, which is in staff support, but we do have some recommendations about how to support staff who have their own reactions to what they see and deal with every day in the NICU, because it can be very emotionally draining.
Yeah. I mean, it's definitely a realm in which you want the psychosocial support. I know we're going to be talking about that in other parts of the series too, but when we talk about, again, how can families advocate for this sort of care and these sort of interventions? So what, the recommendations are done, they've got the evidence behind them, they look beautiful, but now you have to try to put it into action. So what sort of things have you done to help, staff and parents be able to advocate for these recommendations?
Well, on our website, supportforNICUparents.org, we have a document called Talking Points for a Peer Support Program. And it, lists all the pros of a hospital starting a peer support program. And basically, the concept is very simple. It's an add-on that other competing hospitals may not have, and it's
Right, yeah.
the type of add-on that's going to definitely improve patient satisfaction. So it's pretty much a no-brainer once the hospital administration realizes the benefits it's going to bring, but they're just concerned about all the logistical challenges. So we also, on that same website, Support for NICU Parents, we provide a number of resources about how actually to go about recruiting volunteers, how to staff the program, how to train the volunteers, how to supervise the volunteers, guidelines for confidentiality rules and things like that. So we're kind of providing a toolkit to make it as easy as possible for hospitals to adopt these type of programs.
Right. And I mean, that's so important too, when you talk about, we're talking about all of this through the lens of mental health. And so what an incredible asset having these sorts of programs is for a NICU, but then also the guidelines and the recommendations to show that there are actually best practices in how to deliver a peer-to-peer support program, that this isn't just something that, you're winging it as you go along, but there are people you can learn from and evidence-based practices, that support these sorts of programs.
Yeah, and one of the things I try to do when I get inquiries from people who write to the website information at Support for NICU Parents, they're asking about how to start a program, and I always refer them to the Preemie Parent Alliance and hope that they can be matched with another program that has a successful peer support component, so that somebody can mentor these new leaders through the process of starting their own group.
Well, that's a brilliant point too, because the whole reason that an organization like Preemie Parent Alliance exists is in the same way that you need peer-to-peer mentorship as you're going through the NICU experience. It also helps as you're becoming a NICU parent leader, to be able to talk to other people who are doing the same things, who have a common experience. It just really goes to show the value of, an organization like that.
Right.
So, and what it makes me think about too is, as we talk to people, there are other models of peer-to-peer support out there that people should probably be familiar with. We talked about the idea, Christy, you brought up with veterans about the interventions of peer-to-peer support for veterans who have already experienced trauma and maybe experiencing the symptoms of PTSD. But also, Sue, can you think of, are there any other sort of peer-to-peer models that are widely accepted that people might already be familiar with?
Well, one of the first and oldest, of course, is Alcoholics Anonymous, which has a very long track record. there's another mental health one. I can't think of the name right now, but it's for family members who have people who are in their family who are affected by mental illness. And
That's
that's
the National Association of Mental Illness. NAMI has a family program. You're right, with a whole curriculum on this. Yeah.
right. So I think in neonatology, why peer-to-peer support has been so slow to become more mainstream is that we're really supporting the parents of our patients. We're not,
Yeah.
we're obviously supporting the babies, but if we look at our patient population, it wasn't automatically intuitive that our patients, our little tiny babies, need peer support. Their parents do, and now we've figured that out, and we're working on it.
Right, right. Well, so here's the next question. I'm going to ask you first, Christy, I think. If you could wave a magic wand, you've been working in this a long time, you've faced challenges, you've surmounted challenges in providing this sort of support for families, but if you could wave your magic wand and have like one problem removed or create a new program or develop some new resource, what is it that you think is important?
I'm going to repeat myself here. Having mental health services in our NICU. We need more than just peer-to-peer support with our volunteers and our social workers and case management. We need a professional psychologist in our NICU.
Yeah. Yeah, and I know, again, that's something we're going to touch upon, in an upcoming presentation on the guidelines, is talking about the role of mental health professionals in the NICU. Sue, what about you? If you had this magic wand and you were able to change models of care, what would you do?
I would have money growing on trees.
There's so many problems money can solve.
What?
There are so many problems that money can solve.
Yeah, money can buy you a really good psychologist, and money can provide a little seed money to peer support organizations. So, again, the whole point is to get away from the medical model of just treating the sick or premature baby and then giving it back to the parents. The model that we're transitioning to is supporting the whole family, supporting the parents so that they can do a better job of supporting their baby's growth and development. And so the resources to make that possible, and realizing, as is true with most social services, that it's an investment that pays back tremendous rewards and cuts costs downstream.
Right, right. Well, and just the whole idea too that you're working with somebody at a vulnerable time in their life, at a time when they're becoming a parent for the first time or becoming a new kind of parent. And like you said, it's an investment that just continues to pay off over the years, as we see, like you've both talked about, the resiliency that people build, the confidence in their skills as caregivers, their problem solving abilities, their ability to communicate and to deal with trauma. I feel like in so many ways these recommendations that you and Mike and all the other interdisciplinary team have created is just one of those gifts that keeps on giving.
Mm-hmm.
So, Sue, why don't you tell us a little bit more, again, that gift that keeps on giving, as you've done this work and as our colleagues have worked alongside you, you all have realized that there are more things that need to be done. So can you tell us a little bit about the course that you've developed?
Yeah, as we published the recommendations, and then we went around the country and did a lot of speaking at conferences about the recommendations, everybody said, wow, this is really great, but there are so many recommendations. How do we start? Where do we start? How do we know what to do? How do we get everyone in our NICU on board with this? And so we realized that education for this, the way we want providers to adopt new roles, is really critical. So we developed the solution, which is our NICU staff education course. It covers, we have a 1 hour online module, we call it, for each one of the topics of the recommendations. And our goal is for NICU staff to go through this course all at the same time so that there's a cultural change within the NICU such that the family is viewed as the patient, not just the baby. We want NICU nurses and doctors to recognize that the care of the family is part of their responsibility. Again, not just the medical care of the baby. And so, again, everyone says, well, that's a great idea, but I don't have the skills to do that. So we cover the rationale for why this is important, and we have a lot of hands-on learning, scripts for what people can say in different situations, and just a lot of practical tips for how to implement these guidelines. And the feedback that we've gotten from our course has been tremendous. And we also have recently completed a study on the efficacy of the course to improve both staff knowledge and confidence. And the results were very favorable, and they're going to be published in Advances in Neonatal Care journal sometime this summer, 2019.
That's brilliant. I mean, it gives us all just another evidence-based intervention and tool. And it was an example, too, of another, in the spirit of collaboration. Who were the partners that you brought in on this project?
The partners in My NICU Network, which is what we call the organization over this course, is the National Perinatal Association, which, we created this project. The Preemie Parent Alliance, which has been a partner in this project from its inception in 2014. And then we have also partnered with an organization called Patient and Family Care, which does online education. So it's been a great partnership, and we're even expanding beyond psychosocial support of NICU parents to the topic of psychosocial support of pregnant women and their families. So we're developing a course for obstetric providers that should be launched in January of 2020.
It's very, very exciting. And again, just building on that continuity of care and that standard that we hope that all families will encounter when they're getting their care.
Exactly.
So today we've talked about, a few of the different resources and organizations that have contributed to supporting these guidelines and to supporting the principles within them of, peer-to-peer support for NICU families. We hope you take time to visit and find out more about these resources, especially the Support for NICU Parents website. There are some amazing tools there. If you're interested in getting more involved with family advocacy as a parent, the Preemie Parent Alliance is an invaluable resource. And then again, the course you talked about, the My NICU Network collaboration, is just fantastic. I'm so grateful to each of you. Christy Love, thank you for talking to us about the work that you do, and Sue.
Thank you for having me.
I always love talking to you, and Dr. Hall too, Sue. It's always wonderful to hear your insights on this and the kind of breadth of your view and the depth of your understanding, and we really appreciate you being an advocate for our families.
It's my pleasure.
We'd also like to invite you to learn more about NPA's Family Advocacy Network. This network is, again, in the spirit of NPA's interdisciplinary approach. We are parents and professionals working together to provide new standards and new practices that improve the care that families get during the perinatal period. Both of our presenters are generous with their time and their insights, as you can see from today, and what they've done for us. But we also invite you, after you've learned about some of these resources or listen to this webinar and you find yourself wanting to learn more, they both provided their contact information. Feel free to reach out. And as Sue talked about, she talks to people all the time about providing peer-to-peer support. And Christy, I know you do too, and you've been a great mentor to me in learning how to deliver peer-to-peer support. So thank you for agreeing to also share more of you with our audience. So as you're listening to these webinars, and we hope you do listen to most of them or all of them, there are going to be 7 in total, an introduction to the guidelines, and then 6 different ones on the 6 domains of what provides comprehensive interdisciplinary psychosocial support for NICU families. You can visit our companion site, and there you'll be able to see all the other webinars as they're posted, transcripts from them, the resources that we mention in them, and we hope to continue to build upon this resource as the project goes forward, as it bears new fruit, as new people get involved. We hope that you will consider this a resource to learn what you need to know about psychosocial support for NICU families. Thank you for joining us. We hope it's not the last time you do, and have a good day.